Thank you. Thank you, Dr. Abdullah, for your invitation and for giving me this chance and opportunity. I have been interested in this topic since I was a student with all my patients. So I had a lot of patients who used to be terrified, and because we were students and we don't have time, so we had to dismiss them, and they didn't have the opportunity to be managed in our dental college. So I always had that conscious thing inside me that, you know, I felt bad for them. And that's where the story started. Actually, I started to learn more how to overcome this barrier between us and our patients. How can we break that barrier and unlock it so we can have more opportunities to help them, to relieve their pain, and to have them as just regular patients. And that even took me to my master degree, where I specialized in special care dentistry. So before going in all these details, I would like to welcome you all to this webinar and thank you for registering with us. And I would like to say that that's a very good sign that we have human dentists. Like, we're not all about materials and aesthetics and what is related to materialistic part of, you know, our professional. We are also human, and we would like to connect with people on that level, and we appreciate them with all their problems. So thank you all for being here with us. I'm Dr. Hebah Faden. I'm from Saudi Arabia, Jeddah. I work at King Abdulaziz University at the dental hospital. I'm a specialized doctor in special care dentistry. And we're going to talk about a little bit about special care dentistry as an introduction before we go to the actual topic of dealing with dental terrified patients. So why do we say special care dentistry? Because one of the categories, the main categories of the patient we deal with are the terrified, who are phobic patients. We call it patients who have a kind of psychological disturbances when it comes to dentistry. When it comes, they're just like every one of us, and maybe some of us, even though we are dentists, but when we're on the other side of the chair, we actually feel a bit of fear or phobia even. So as a dentist, we have to treat all type of patients, and I'm going to start my PowerPoint here. I hope if you have any, just a minute, if you have any comments or any questions, you can see the chat box. You can enter it, and Dr. Abdullah will be following with us. He can just tell me if there's any questions. I would like, before I start, also to yes, Dr. Abdullah, you're with us. Yeah. So we always say there's 4 types of questions. Okay. There's a question that is directly connected to the topic, to the point I'm talking about, and I will answer it right away. Okay. There's another question, which is, I know some of you, mashallah, they have very fast thinking, and you may be jumping to areas that are related but not directly. So I will defer the answer to a later time in the presentation within today's webinar, but later on. The third question may be something not very much related, and allow me please to have, you know, the answer later on. We can contact with our emails or with any other mean of communication, and we can discuss it later. And the fourth type of questions is the question that we all in the Quran we say وَفَوْقَ كُلِّ ذِي عِلْمٍ عَلِيمٍ. So sometimes there's some questions that even me I don't have the answer, and we can search and look for it more and do more research about it, and maybe we can meet again and discuss our findings. So for the time being, any instant question or comment you would have, I would welcome any interaction with you guys. I would love that interaction. I would very much appreciate your emotional engagement with my lecture today, with my talk today, and whatever you want to comment and say, I would just like you to put it here in the chat box. So whenever you're ready, just please, as a way of interaction, just write one in the message box here, in the chat box, please. Can you all, if you're all here with me and focusing with me, just write number 1, because I'm gonna start with the first poll. Well, you can all vote for a question I'm gonna put. So I just want you to put here, look for the chat box. Okay. Yeah, great. I love the ones. Yeah, great. Thank you very much, Dr. Nermeen from Oman. Yes. Great. I would also say something, as one of you guys are saying ma'allik, so there's something wrong. If any kind of technical problem happens, this webinar has a very unique kind of thing. It will transfer us all to another room where we can continue, and you don't need guys to go out or panic or anything. It will redirect us to another room. So please just give it like about 10 or 12 seconds and you're going to be directed, but hopefully nothing will happen like that, just so we can be on the same basis. And okay, so our first poll, I would like to ask you, it's a very simple question, and I would like you to be very honest in it. Okay, let's see your answers. Okay, you're gonna have a question here. Yeah, wow, nice interaction. I love this. Okay, I want you to be very like transparent and authentic in your answers. Okay, so when you have dental appointment as a patient, if you feel more than 5 from 10 anxious or fearful, please just vote with an yes. Wow. So I can see that. I'll give you 3 more seconds if anyone did not vote yet, or yes, I can see it now. It's increasing. Yes, so we will end this poll. Wonderful. So the poll says that 54% of us, 54% of us are kind of afraid. They don't, you know, well, let's see here. Yes. So 40, okay, 45 of us don't like to go to the dentist. So how much of us, there's another question I would like to, okay, beautiful. Okay, so there's another one, another pool. Yes, wonderful. So 45% of us don't like to go to the dentist, actually. And how about fear? Do we feel a kind of fearful, apprehensive, or not an ease to go to a dentist? How much of us? Okay, so 14% of us, yes, they feel afraid, kind of, to be on the other side of the chair, the dental chair. And no, 36%. Okay, that's great. And sometimes, which is I think the real answer, or most of us feel 48%, they feel a kind of afraid going to the dentist, where we have this, you know, ups and down in our feelings according to what's the pain. Is it a kind of severe pain? Maybe we would be more afraid, or less pain when we are less afraid when we have less pain. And that's very logical. Okay, so now let's go to PowerPoint. Okay. So, just a minute, please. Thank you for all your answers. So, thank you for your answers. Now, I'm going to share my screen with you. Okay. So, here we are. We're going to start with a small introduction, okay, about the specialty of special care dentistry. So what is special care dentistry? Special care dentistry is a new specialty that arose about 2008 in UK, and it has been spreading throughout different countries such as Australia, Brazil, New Zealand, and special care dentistry is dentistry that is keen on providing the improvement of oral health of individuals or groups in the society who have different kind of disabilities that is sometimes form a barrier between them going to the mainstream dentistry. such as physical disability, sensory disability, intellectual disability, or as we call it in UK, they call it learning disability, is intellectual disability, where the IQ is a bit less than the average IQ in that age, mental disability, medical or emotional disability, social impairment as well, or more often a combination of number of these factors. So this specialty is concerned about people who have any kind of problem, 7 categories. We treat these type of patients. We are dentally, okay, and we are trained to consider all the other factors that may have a direct or indirect impact on their oral tissues, such as the disease itself, and its effect on the biological tissues, and the medications and what it may have, and the psychological impact and the social impact, as well as it affects the treatment plan we're providing for the patient. So we have to consider in every one of these type of categories all these different factors that would make the treatment ideal for this type of patient. It's very important to note that in special care dentistry, we are treating patients who are about 16 and above. What we mean is adult patients. I have a lot of questions that comes about patients who are children, and children, special care patients who are children are within the pediatric dentistry department. They are covered there. One of the main causes this specialty arise is that a lot of patients who have these type of disabilities are not seen by dentists. Even after they finish the pediatric, they grow up, they are lost in the system, and the other dentists don't feel they are competent enough to manage them. And one of the main very important point to note here is we have this emotional category. So what differs the definition here of special care dentistry than any kind of other definitions related to special care education or special care people, that here we have a new category introduced into our specialty, is the emotional disturbance or emotion. Yes.
البرزنتيشن ما واضح عندنا يعني.
Yeah. Sorry.
ماني شايف البرزنتيشن حقك عندي فما اعرف.
Even
اشوف
like
صورتك
this?
بس اشوف صورتك بس ماني شايف البرزنتيشن. ما ادري عن بقية الحضور اذا كان يشوف.
Okay, can you please write in the chat box, because I already shared my screen. Can you see it? It's a slide that has what is special care dentistry. Do you see that slide? Yes, doctor.
ممتاز واضح عند الجميع شكرا.
Okay. So we have here what is special care dentistry. Okay. So we have here the obese patients, we see them, we have special equipment, special chair for these type of patients, because the regular dental chair, it doesn't take more than 175 kilograms, where we have some chairs that takes like up to 400 kilograms. Did we ever think about these type of patients? These are type of patients we see, and Down syndrome patients and other patients. So why did I do the poll? Why did I ask you all guys about your emotions? We can find that a lot of us, even though we are dentists, but when we sit, and I'm one of them actually, when I sit on the dental chair, I start to feel apprehensive, and sometimes my fear scale starts to go up. And we can see this is something that is historically known about dentists. We don't really have a very good reputation among people, and people don't really like us. And I saw a lot of patients who come and sit on the dental chair and they start telling me, doctor, I want to tell you something. I hate dentists. And I'm like, okay, بتقولوها في وشي كمان. You're saying get it out in my face. Just, من باب الذوق, يعني try to be just a bit of communication skills. But I really, really understand their feelings. And this is why I learned a lot of approaches, as I said previously. So in special care dentistry, one of the main principles and the philosophy of special care dentistry, we're setting the ground here. Before we learn the techniques, we have to have a mindset, the correct mindset to treat these type of patients. So what is the mindset? What is the philosophy that we are considering and believing in before we approach these patients? We have the medical model, okay, that all of us know and very familiar about, the measures of absence of disease. This is the indicator of health. But nowadays, there is the social model that comes within our field. It's the measure of the well-being and emotions. If you see the definition of health, according to the WHO, we can see that the well-being is part of the health, okay? So the emotions are considered as well. So what the patients, if you're a very successful dentist and you do a very good inlays and onlays and very good prosthesis, but you don't have that edge of understanding the human nature, of understanding how the patient will feel well, how do he feel throughout the process of doing his dentures or having his dental treatment. That is a big gap between you and the patient, actually. So in our special care dentistry specialty, we combine both of them. And according to that, we have to consider the patient's feelings, the patient's emotions. And we tell them that we are a medical and a social environmental approach. We're using that, and we really value your emotions. So maybe we saw that picture of a terrified patient before. We have to know, after knowing, first of all, the philosophy, the second thing is the profound effect of our words, okay? How much does our words have an effect on a person? We can remember a day in our undergrad or postgrad studies where our teacher said something, our instructor said something, and he made our day, or the opposite. Maybe he said something or she said something that we really feel we were kind of discouraged to continue, and we had a bad mood that day. Words are very important, and how we use the art of using the words is very important in dealing with these type of patients. It has a very high impact to heal the patients. So we are going to talk briefly. We have only 1 hour, and to cover this topic, where actually to go in details, we need like maybe days, and to go into the specific treatment approaches and technologies and all that. But we can cover like broadly a broad idea about it. When all of us maybe studied fear, we learned about fear in the pediatric dentistry program more than other subjects during our studies. What is the definition of fear? That that very weird feeling about something that is maybe unknown or known sometimes. What is fear and what is phobia? When we're talking about phobia, we mean something beyond fear. It's even more than fear. I had a patient who, his sister actually knows me, and she called me and she said, I need you, like, for emergency case. My brother is terrified from going to the dentist, and he needs someone that would really understand his case. He came to my clinic first day in the morning, next day, and mashallah, I saw a very young man who is like 2 feet longer than me, and he was, mashallah, very well fitted and everything. But once he sat on that chair, what happened to that guy? He started to have these tremors. He started to be like exactly a 7-year-old boy who was afraid of the dentist. And he was even very much embarrassed. I can see that his teeth and his gums are badly inflamed, bleeding. And he took the anesthesia from the spray from his pocket, from his fob, and he told me, look, I went to the pharmacy, and because I have severe pain and I have been taking analgesics and antibiotics, and I even use this and I spray it into my mouth just to avoid going to the dentist. And he told me that he had a traumatic experience when he was 8 years old at the dentist, when he had a lot of pain, and the dentist just started to drill and fill and extract, and he was considering him bidalla, like he didn't take his emotions seriously. And that caused that he was a very nice looking guy, but whenever he smiled, that was very embarrassing to him because his teeth was totally damaged. So he avoided going to the dentist all these years. We can see that the causes may be directly as experiences, previous experiences. Some of the patients come because and have that fear because they have been witnessing their mother or their father having painful treatment. Some of them had that fear, exaggerated fear, because of the medium, and maybe all the the dentist roles that comes in the TV and the movies. They don't put us really in a very good scenario where usually we're the bad guys in a way or another. So we don't really have that kind of reputation again. So that's another cause. They're really afraid. Some of them have they heard about the complaints of other people of going to the dentist and having. So the fear is very logical, but the exaggerated fear, the fear that reaches the phobia line, where they are even very much afraid to go to the dentist. The idea of going to the dentist just brings them to an edge, where we say in the epidemiology, in some of the studies, they say that more than 60% of some populations have very high fear from going to the dentist. And in other communities, there's 10% who are fearful to that extent they don't ever visit the dentist. Even if they have pain, they just go for extraction, and that's it. And I think in our communities, in Arab countries, whenever I go into like a party or anywhere where there's a gathering, social gatherings, before the COVID-19, usually people would say, I hate to go to the dentist. I don't like to come to you guys. You have a lot of tools that really terrifies me. And they start to talking about this part of dentistry. And it's very obvious that most of the population have this uqda, this problem complex about going to the dentistry. And this is why I think this lecture is not only for special care dentists, it is for all of us. All of us are involved because a lot of our patients have that emotion. The impact is starts from the day before they come. So there's physiological differences, and there's some like signs and symptoms. They reported feeling stomach pains and anxiety, insomnia. They feel muscle cramps. They feel tense. They had headaches. They couldn't eat. Loss of appetite. All that is a sign that they are phobic, not just fearful from going to the dentist. And I have been treating these type of patients. Some of them, when they just hear the voice of the drill before even coming into the clinic, they start having these shivers, and they start shivering and start, to feel the high intense feeling of being afraid to come in, and they even start crying. Some of them just stand at the door and they freeze. They don't want to come in. And some of them just delays, the visits, and stop, coming until someone push them or come with them. So all that has an impact on the patient. And the positive side, some of them have very good oral hygiene, and sometimes they brush even very hard because they feel that tense and that kind of stress when they're thinking about their teeth. They even have complications of very good oral hygiene because they want to avoid going to the dentist. That's a positive side of that fear. So we can see a positive side of a fear and negative side, and the negative side is more profound. We can see it spread to most of the population. On the staff, when they come to our clinics, a lot of us, me myself, before having the training in special care dentistry and all the other training workshop I have been attending, we feel as it's kind of contagious. All that problems that related to their fear is reflected to us. Me, my assistant, we also feel stressed. Sometimes when they're sitting in the waiting room, they also reflect that fear. And the other people also, the receptionist told me the type of talks that they have while waiting. Also, that has a negative influence on the other patients that are visiting. There's a lot of research talking about the threshold of pain. So whenever the patient is very, very anxious, actually they do not feel the pain the same way that an anxious patient feel it. The threshold of pain goes down and the intensity of pain goes up. So with a very small touch, that patient can jump from the feeling of pain. And you may say, I just touched you, very small touch with the probe or with the mirror. It doesn't even, but the threshold of pain is magnified, and you can it's very low, and the feel of pain, the actual feeling of pain, just goes up. And this is why patients, maybe if you're not an expert in this area, or you didn't read much, you may consider this patient is just a kind of the kind of, he's not really serious, we don't take his feelings seriously. But it is a psychological restraint, as some people cannot walk, cannot go to the dentist because any health problems. This is a real problem that prevents them from coming, and we have to take it very seriously and take it in consideration in the treatment plan. So the types of fear, we can uh, put them in categories according to different the cause or what are they afraid of. So some people are afraid of drilling and filling the handpiece. Some people are afraid of extractions. Some people are afraid of the dental needle, the intraoral injection. Some of them are afraid of the RCT, the root canal treatment. So for us to know all that, we need a measurement. We need to be more specific. And this is where we go to the measurement part. Okay, the most famous anxiety scale, and there's a Arabic version of it. You can even Google it. Is the Cora Dental Anxiety Scale. Okay, it had originally 4 items. It was done by Norman Cora in the 60s, but it had been modified afterwards to be more convenient to us dentists clinically, where one more, we can see the question number 5, if you can see the screen. If you were about to have a local anesthesia injection in your gum, above and upper back tooth, how would you feel? That is the 5th item or 5th question that was added to the dental anxiety scale, because before it didn't have anything related to the local anesthesia. So now we have that, and we can know what type of phobia does he have. And you can see, if you downloaded that scale, how you can score it. And the people who are going above 19, the cutoff is 19. So who are going above 19, they are considered to be phobic patients. And once they are considered to be phobic, we start to study the case very well and see what is the best mean to manage these patients. We have different way to manage them, and we have a hierarchy of treatment. So that means that we have to start with the psychological approaches without introduction of the pharmacological interventions, the pharmacological like whatever, giving any kind of sedations or whatsoever. We have to start psychologically, and this is very important ethically, and it is the professional way of doing it. A lot of people who comes to me says, our dentist said we have to be gone and have our treatment under GA. And this is a big mistake. This is a misconception. If we learn the management properly, we have to consider a lot of other approaches before we go to sedation. So first of all, I didn't write to number 1 or number 0, which what we learn in the pediatric dentistry subject or program, where we learn the tell, show, and do, how to talk simply, how to explain, and all that kind of stuff. We do that even with our patients, but when it's a phobic patients, that's not enough. And this is why where we come to approaches such as hypnosis. Hypnosis is 3 days, or sometimes we have tried to condense it to a 2-day program to learn the details of hypnosis. And maybe we would have a workshop if we would like. Please tell us. We can arrange a workshop in hypnosis. What is hypnosis? We're going to talk about it. And it's the power of words, how to use your tone, how to use the right, correct words, how to use your eyes, your breathing to reflect relaxation on the patients. and to guide them through that with confidence, with calmness, with comfort until the end of the treatment. Then we have the CBT. Sometimes hypnosis is not enough. Hypnosis is we can use it with the mild, because we have mild, moderate, or severe phobia. So we can use the hypnosis with the mild or the mild to moderate cases, okay? But once they are moderate or moderate to severe fearful patients, we have to use other types of approaches and methods. It is CBT, it's cognitive behavioral therapy. And there's this tool that you can, I think, buy it from the website of King's College London, where I had my training. The cognitive behavioral therapy for adults with dental anxiety toolkit. It is a toolkit where we use the CBT approach. If you don't have a background about CBT, there's a book which is called CBT for Dummies. It is very, very informative. It has all the psychological terminologies are described in a very nice way, very simple way. And we can see that the CBT approach depends on break the big task into very small, detailed tasks. So and we take the patient away from the dental setting. So in the CBT, where we give the CBT to the patients who have moderate to severe phobia, into office setting, away from the drills and all the sounds of dentistry. We have a very good rapport with them. We initiate sessions. We tell them that we will have 6 to 10 sessions within that office just to treat the phobia. And according to the studies, my thesis was all about CBT and dentistry. So in the Dental Institute in King's College London, there's a professor who I really admire. He's Professor Tim Newton. He is a psychologist specialized in psychology applied to dentistry. So in this area, he teaches all the dentists, okay, and he has a special program. It's a course also to all dentists and special care dentistry and specific, but all dentists can apply to that. And we have the workshop where we learn about how to apply the CBT on the dental patients. So what we do actually is we start with them with very small tasks. For example, if we just had the syringe, we don't put the carpal end, because usually if they have a phobia from the intraoral injection, they always talk about, okay, you have a very big injection, this big, and it's very painful and this and that. But when they find that it's like 15 or 20 centimeters, it's just like this, it's very small, and we have it drawn on a paper, and they can see it, okay, in front of them, and they say, no, I know it's bigger than this. You're just, joking with me. And this is the actual size of our needle. They that's a big shock for them. And then we open the needle part, the syringe part, the carpool part, and the other part. We put it in pieces, and small pieces, so they can see that they are very small pieces. And the part that is injected is like a very small part. It's not the whole thing. So when you are talking, and communicating with their cognition and destroying that kind of myth they had about how huge the injection is, that's the beginning. And you go step by step. Every time it's like a half an hour or so. and talking with the patients and knowing what is the phobia and trying to discuss with them the problem they're facing. The studies show that when the dentist himself is doing all this, maybe you would say, okay, I would refer to a psychologist. But the actual studies show that when a dentist is doing that, the results are much better, and 90% of the patients showed complete, healing from that phobia, where they can go to any dentist, not only a special care dentist. You're opening them up to better opportunities, so they can go to any dentist. They can have their dental treatment anytime, without the need of sedation or GA or even having this kind of treatment again. And that is a upper hand for CBT, because whenever they're having sedation or GA, that's extra cost on the patient if they're in the private, extra cost on the government if they're in a governmental hospital. So using CBT, it removes a lot of patients from the list, and it gives us even a technology or a kind of method they can use in dentistry and in other areas of their life as well. So CBT can be used in a lot of areas to improve the quality of the patient's life, including care and dentistry. We have a workshop now in CBT and how we can teach it to dentists, and we can plan sessions, 6 sessions or 10 sessions, according to the severity of the phobia of the patient. Sometimes he has a fear more than one thing, not only the injection and the drilling, the sound. So we give them even CDs with the sound of the drilling or the suction. I had a patient who had a phobia from the suction, and when she went through the treatment and she was improvement, the only thing that she would be comfortable with is holding the suction in her hands, to be able to feel the control of having it on and off her mouth, putting it in and putting it out of her mouth. So again, we go into different levels in the CBT part, okay? And we break it into small pieces. Every session, sometimes we just uncover the needle and put it near to the face and count to 30 seconds. If they withstand that, that is an achievement, and they are acknowledged for that. And that's enough for the day, where the next visit, we can do something else, where we can just put it near the gums, for example. And we go into these steps. We start the first visit after the CBT with only prophy, and prophy with the 2 incisors only. And we consider that a big achievement as well. So we have to be really reassuring to the patient. And I always say something, don't give the cure, be the cure. Be the cure means you have to work on your own mindset, your own tolerance, your own way, your own communication. You have to learn how to build the rapport with the patient. And once that's done, the patient comes, and even a lot of referrals comes to you if you're in a private clinic, and you can see the big effect of your humanity, of your empathy with that patient. And it's really feel very satisfying before even thinking about any pharmacological approaches. But sometimes the patient has severe pain, and he cannot wait for all these sessions, and we need to go directly into the dental treatment. So we either go in parallel, we have the sessions of CBT or hypnosis, and the sedation on the other hand, okay, together, or if the dental problems are not profound, we start with the CBT. So first of all, we try to start if it's a mild case. Again, we start with hypnosis, and then we can use hypnosis alone or hypnosis with inhalation sedation. Okay, if we are not, the patient has mild or mild to moderate um, phobia, so we can turn into CBT. We have CBT alone, or if he have dental problems that need to be managed right away, so we do the CBT sessions and we have him treated under sedation. Okay, not GA. We have to understand this very good. Not GA. So we go, first of all, we try the sedation. Okay, so we according to that, we said it's very important to have a very good history of the patient. We talked about I referred to that social impact and understanding the social background of the patient and the treatment plan. So we try to choose the best that offer the best quality of treatment and best results for the patients according to his also social background. So we can provide inhalation sedation, and if he doesn't have an escort with him who comes with him into the clinic, and he can, have 100% oxygen after that, and he can just stand tall and regularly has a very regular, gait movement, and he can go home without having an escort. But if he does have an, we can do IV sedation. And inhalation sedation, which is a pharmacological, we started in 5, is all about pharmacological approaches. So in inhalation sedation, we are talking about a patient who has a mild phobia or anxiety, okay? When they have severe anxiety and phobia, even the inhalation sedation is resisted and refused. So we go to the IV sedation. In UK, as a dentist, we are qualified and we have the opportunity to treat these patients without medical anesthesiologist with us or any kind of supervision. So we can the safest, or the one that we usually use is midazolam, and we are retrained again how to use it intravenous, and sometimes we use it intranasal as well, and we use like 30 minutes window. We do all our treatment in that 30 minutes, and then the patients need an escort after that and to go home. If the patient is coming from somewhere far, or he has a lot of, caries and treatment to be done, if the patient has severe pain and has to have, the treatment right away, we have to put him into GA. Okay, so but we don't go right away to GA. This is not correct. This is not professional. Especially if the patient has a lot of our special needs patients, special care patients have other problems where they cannot go under GA, respiratory problems or any other problems. So we really need to consider the other approaches, and we need to learn them and read more about them to be able to help our patients. So, sorry, I need to go backwards. Here we're talking about hypnosis. Hypnosis is still underused, okay? It is a non-pharmacological tool where we use our voice and we use like certain skills to provide an effective sedation while maintaining the patient's collaboration. We look to the patient's eyes, to the body language. We see how he's breathing, and we help the patient to recover from the dental anxiety or phobia, as well to those with severe gagging reflex. So the people with gagging reflexes, we also use acupuncture, where we were trained in King's College to use the acupuncture with these patients. But some of them can be treated with hypnotherapy, with hypnosis, with dental hypnosis, or hypnodentistry, as some of the people like to call it. So again, helping these patients. There's a lot of research in the area of hypnosis and dentistry. I myself took the American Board Certificate of being a trainer in hypnosis. And in hypnosis, we have the patient's brain waves. He goes into there's four categories where we call the beta waves, the alpha waves, and here, this one is the beta waves. It's where the waves are the highest. It's the one like when we go shopping or anywhere, we're completely alert. That's where we have the beta brain waves. Then there's the alpha brain waves from 8 to 12. That's we call it the best learning. We call it حالة التعليم المثلى, the ideal learning phase, where the patient or the person is in trance, and they feel very much relaxed. They absorb the suggestions you're giving. They can absorb, relaxed and absorb the information you're giving, and they have a very positive response. And then there is the theta, where the brain waves go down 4 to 7, and they can be very, very open to suggestions. And this is where we work in hypnosis, from the alpha and the theta levels, where we give positive affirmations during the treatment and through all the process and the procedure before the patient reaches the delta, which they sleep in the delta, the 1 to 3, where it's 1 to 3, the brain waves is 1 to 3. So we can see here that the patient can go to a very what we call relaxed, calm, comfortable place, area, and be very open to your suggestions. So this is why we learn how to put hypnotic scripts. We know how to, and what we mean by script is the words. What are you using a story? Are you saying it in different words, like relax, you're in safe hands, imagine yourself with bright teeth. You know how to talk to your patients, how to be a good hypnotist. This is another, sorry for the people who doesn't talk or read Arabic, but if this is an extra slide where we are talking about the skills that is needed for a hypnotist. So you need to calibrate. Calibrate means you need to understand and you need to realize the differences between the patient when he was in a stressful situation, when he was in the sympathetic mode, and when he goes to the parasympathetic mode, from the rest, from the fight and flight mode to the rest and digest mode. So it's very important for you to be able to notice and recognize these differences. And that will help you understand in which level is the patient during the hypnosis session, so during the treatment. So for example, I'm starting with him, I'm starting with very good communication skills and rapport and welcoming the patients. I'm having the mindset of I am the cure, I am the process, I am the process of healing this patient. My body language, my words that I'm using, my tonality, the tone of my voice is very important when dealing with these patients. So I start off with this, then I go gradually into realizing that the patient is calming down the muscles, the tone of voice, the parasympathetic functions, all that needs to be calibrated. And then I go into a deeper, stage of hypnosis where I try to align my voice with the velocity or the speed of my talk. So whenever I'm going to a lower speed, lower voice, smoother pitch of voice, I allow them to relax. And I ask them, you can relax now, you can think about something you like, and I guide them through that to the place they are going. I realize the breathing. And me, myself, I like to start with the breathing actually, where I always tell them take like 3 breaths in with the nose and take it and exhale in 6 counts. Like then again in 3, exhale in 6. When they can do that, that means that is a very good sign to start, because when they exhale in 6, that means they are kind of relaxed. If they are apprehensive, they can't. It's like they cannot just put it like very slowly in 6 counts. So again, and I do it with them, and I use my body language to introduce that type of breathing to them, and I teach it to them. They can do it even at home, and I ask them to do it every day until the next visit again. So the breathing is a very important point in our process. There's other points where we learn how to induce the hypnosis and go further on, and hopefully, inshallah, we can arrange a whole workshop for hypnosis. If you would like to, you can be in contact with us so we can tell you more about the date and the time for that. Mainly, this was the management of the dental patient with dental phobia, going from the psychological, the non-pharmacological approaches, and reaching the pharmacological approaches, learning a bit of this and that, that would help you as a key factor in managing the patients, understanding what would you do, what you need to learn. I know maybe you didn't have a depth of, learning the skills, and that would need more time and more training and more interaction where I can hear you all and we can practice it together. But it's very important for me to know, to let you know where to refer them if you don't know what do you need to learn, and the hierarchy of the management, and what to recognize, and the importance of considering and validating the emotions of the patient, and giving them the feel of acceptance. You are accepted, even if you are fearful. Because there's a lot of research about how patients are embarrassed, and they don't go to the dentist because of the embarrassment. So we want to remove that barrier and let them just be authentically in our clinic, and they can express their fears, and we can accept all that. We can understand their experience, and we allow them through that acceptance to heal from the fear that they have. And it's a lifetime experience. It would make a big shift and transformation in the patients' lives. I encourage you all to learn more and be with us more. If you would like to go into online, there's online courses as well to learn more about hypnosis, more about CBT, where these areas, these topics are not very much discussed in our dental curriculums. We need to learn from more, and I can tell you that you can use it yourself in your actual life as a dentist, because we are going through a lot of stressful moments in our practice. So even learning the hypnosis for self-hypnosis, using CBT for your own self, quality, improving the quality of your life, that will help you even more in reflecting that kind of calmness on your patient, and it will help them realize the effect that it may have on them, and the cooperation and connection between you and them improve would improve so much. Thank you all, and I welcome your questions. Empowering the people with disability, and here the emotional disability is one of the disabilities we consider, we put in mind. We acknowledge the patients. They have the right, the total right to feel whatever they want to feel, and it's their right to be respected, to be acknowledged, and to be helped. And we are here for them, to give them that. And the World Olympics, I had the opportunity to see a lot of patients from more than 70 countries with different disabilities. And I am really proud of this picture. This is why I put it. And I encourage all of you to, whenever we have the opportunity to be a part of the volunteers. We had more than 23,000 volunteers in the Special Olympics, the Olympics for people with special care. It was a wonderful, wonderful experience. I always would like to talk about and promote. It gives us a lot. It teaches a lot about how to empathize with people with disabilities, and how to simplify our dental treatment for them, and how to approach them in a better way, and keep the development, keep the pathway of development in our lives, where we can always learn how to excel our skills and learn more. Thank you very much, all of you. And I am very happy that you're all here with us, and would like to have your questions. Any
Thank you
questions?
very much. Thank you very much, Dr. Hebah. I mean, this is a great presentation. I loved it. I think it's personally, like, I will never recover from my phobia to go to the dentist. So I'm going to start the session up by just giving a question so that the audience can prepare their questions too. I just wonder, like, your experience, where do you see the comparison between using CBT versus conscious sedation in patients who are overly terrified to go to the dentist?
Uh, well, we don't use. What do you mean by conscious sedation? You mean the sedation using the pharmacological approach?
Yeah, absolutely.
Yeah, because we also talk about conscious sedation and hypnosis, where we don't use any pharmacological substances or approach. So this is why I'm asking you. But as I said, there's a hierarchy. So first of all, we start with the non-pharmacological. Ethically and professionally, we are supposed to start with the non-pharmacological approaches. So we start with hypnosis, we start with CBT, and then if that doesn't work with the patient, we go into conscious sedation. And if the conscious sedation doesn't work, or if the patient's, other factors like social factors and so on, we consider the GA. So the GA is the last in the hierarchy. We don't jump into GA like most of the dentists, what we see in the general practice these days. They jump into GA, and I consider this really haram. It's not the right way to do things. So I hope that answered your question, Dr. Ali.
Dr. Abdullah, of course, yeah,
Dr.
you did.
Abdullah, sorry.
That's fine. We're waiting for the audience. If you have any questions to Dr. Hebah, this is your chance. You can post them in the chat, and then Dr. Hebah will go over them.
Any questions, guys, girls, doctors, colleagues? So, doctor, we can see that I had a workshop, several workshops actually for hypnosis here and some international conferences abroad, where we trained on hypnosis, the actual skills. And in the training workshop, we have like a one-to-one mentoring and the voice, the tone of voice, and we teach it to dentists and even other specialties. I had lectures for family medicine board, Saudi board here in the National Guards, where we had a lecture about hypnosis and how to use hypnosis with the patients, especially when they are stressed or a kind of they're having their fearful moments before like operations or before a specific medical procedure, or sometimes they have kind of burnout or something, how to use hypnosis with them, how to use hypnosis in the stress management.
Sure.
All of us, we have as doctors and health practitioners, we have our moments where we suffer from stress, and we have to learn how to induce the self-hypnosis to ourselves as well. I think that's number one. If we are, then we can use CBT, cognitive behavioral therapy, and there's a lot of research that supports both hypnosis and cognitive behavioral therapy.
Yeah.
Any other questions?
From my side, no. I'm just waiting for our dear audiences, like if they have any questions to post in the chat.
Yes.
Any question you can post in the chat.
Mm-hmm. So I hope you enjoyed the lecture.
We have a question from Manal.
Yeah.
She's saying causes undergo to management session, did they really show a change in the behavior? I mean, significant change. They say cases undergo to management session, did they show change in the behavior? Any significant change in their behavior?
Yes, sure. You mean what kind of, you're talking in general to the management sessions. The management
Yeah,
include
I'm marking
everything. Yeah, the management include everything. Yeah, when we say management, we say the management of the phobia itself, and that includes different parts of it. There is the management before, the management during, and the management after sessions. Okay, it's all considered part of the management. So if you mean, I think you mean the management that is pre-clinical, pre-dental, clinical work. Yes, very much, very much. And there's research about that, a lot of research about that actually, where the patients heal completely from the phobia they have. And that's very important because it has a lot of advantages. One of them is now they can have their treatment um, in a calmer state. They are relaxed. All the psychological impact that it used to have on them and the physiological impact is just gone. So they are really relaxed. Quality of life is better. They can not. So if they come to me as a special dentist because they have phobia. Now, if when I treat them from this phobia, dental phobia, they can go to any other dentist. So they're not just linked to me, or they're not tied to a special care dentist. Knowing that even abroad, even in UK, special care dentists are not available, everywhere, and the number of special care dentists are still, you know, uh, what we say, a lot less than what we want. So now, if they are healed from the dental phobia, they can go to any other dentist. They learn quality for life. It's a skill. They can use it everywhere else, not only in dentistry. So they can use it in their everyday. They can teach it to their children as well. And the fifth thing, they don't need to go under sedation and GA. So if they are going, that's cutting the cost off. If they are going to private, so it's like it's going to be a very very good opportunity for them. So they don't need to go under GA and all the cost that GA here is not less than like 8,000 riyals or so. So and even sedation, it's they don't need to have any sedation. They just be like any regular patient, and we see it a lot. And there's like 90% of the patients who go in CPT, specifically in CBT, as research has shown, they have total. They completed the sessions and they have total healing from that dental phobia. I hope that answered your question, Dr. Manal. And thank you very much. And I'm waiting for you as well. Thank you very much, Manal. Okay, Jihan.
Uh,
Is hypnosis applicable in the field of pediatric dentistry? Sure, sure. Before I was specialized in special care dentistry. I learned hypnosis. I was a trainer in hypnosis, and I started with pediatric patients. And subhanallah, I saw a big, effect on them, especially when you use, inshallah, when we learn hypnosis. We would know that there's more than one approach in hypnosis. One of them is that storytelling. So in the storytelling, we use a story that would calm the child. So it's like when Ahmed, for example, went to his grandmother, he used to always have a bedtime story. When he goes on his bed, his grandmother would tell them about her childhood long time ago, where she used to sleep under the tree and she used to dream about. So see, we are using a story where there's a lot of sleeping, dreaming, something that's long ago, something that's engaging the cognition of the child. And at the same time, the words are suggestive for him to calm down and be more comfortable and think of something away from the fear and needles and pain and all that stuff. So it's very very useful. And subhanallah, at that time I people used to know me as a pediatric dentist. A lot of dental, uh, children used to be referred to me, but not these days. These days, I only see adults with special needs, and we can surely apply, Dr. Jihan, that in pediatric dentistry. I have a lot of examples in this area in specific. And some of them are very funny, but I reassure that it is very beneficial with pediatric patients. Okay, is there any other?
No other questions, Dr. Hebah?
What's the other? I can't see. I'm trying to go through.
Um, I don't see any further questions from the.
Okay, yeah, no further questions.
Um,
Okay, so I hope you enjoyed our simplified content, and I hope we can meet
very.
again and more in depth in this area. It's one of my favorite topics because I can see a lot of our population suffering from phobia, and
That's true.
Dr. Abdullah, he's here.
Oh
one of
yeah, I'm one of them actually.
I would like to say something before we end this lovely gathering, is the power of words. So always use positive words. So we
That's
never
true.
say to the patient, don't, يعني in Arabic we say, لا تخاف, don't be afraid. We always direct the thinking. When I tell you, think about a white horse, or don't think about a white horse, you will directly think about the right horse, because our mind grasps the idea without the no. Okay, so if I told you think about a blue bird, actually you're not going to think about a white horse. So it's the same. It's the same in dentistry. Yes, we say انت شجاع, for example. We say you are very brave. انت ما شاء الله عليك. This when we are treating with children, but when we are treating with adults, we're gonna say about the طمن. This is a very simple procedure. I want you to know that it's going to be, we always give them control. Raise your hand like we do with pediatric patients. Raise your hand if you want to tell me anything, if you want to stop. So you give them control. And this is very important, to give them control, and to give them also a positive idea to think about. This is simple. Please relax. اطمن. لا تقول لا تخاف. لا تقول ما راح يألم. لا تتكلم عن الإبرة. Okay. Say أنا هعطيك البنج. البنج هيريحك. ما هقول لا تتألم من الإبرة. كلمة إبرة وكلمة بنج لوحدها, يعني it brings all the fear out of our gut. It's just stimulating the fear. So again, choosing our words, as I said in the beginning, I would like to end also with choosing our positive words. اهدى, ارتاح, اطمن, بسيط, هترتاح. تخيل ابتسامتك الجميلة, أسنانك ما شاء الله مرة قوية, شيء بسيط وخلاص هننتهي. الكنترول في إيدك, وقت ما أنت ترفع يدك أنا راح أوقف. These are very, very, very powerful tools, and very simple. And it's very important also to use the breathing technique in the beginning of the dental session. And thank you very much for your attendance. And thank you, Dr. Abdullah, for having us here in the webinar.
Thank you very much, Dr. Hebah. Really was a very interesting webinar, and thanks to the audience really who made it to attend. And thanks to the Saudi Edu Blad team, each one of them. And this webinar will be replayed like over the next 3 days, and it's also be gonna will be actually in our YouTube channel, inshallah. We hope, Doctora Heba, that this is not the first and last, but just this is the beginning of a series of having you to deliver more webinars on our platform, and we welcome you all, and also we welcome the people from the audience to join us on the SaudiEdublad.org, and they help us in providing these webinars to the students, to the physicians, to the trainees, and whoever is interested. Thank you very much, and have a good night.
And I would like to remind them that Wednesday, I think we have the emotional intelligence work,
And that will be on Wednesday. They
yeah.
don't miss it. Please go ahead and register for that. It's on our website. It's also in the Twitter, and Manal might even share with you right now, because I see Manal interacting with the audience.
Yeah.
So please don't forget to register for that important topic, which is about emotional intelligence.
Yes.
You will use it even in your clinic. I think it's part of the art of medicine, not
Yes.
just for leaders and for like people in the decision-making process, but I think it's also for us as physicians and those who provide direct care to patients. It
Yes.
enhances our empathy, it enhances our humanity, and I think it's a very, very important webinar to attend on Wednesday, inshallah.
Yes, inshallah. Thank you all. Thank you, Dr. Hazem and Dr. Nizar, Dr. Manal, and all the Dr. Jihan and all the people who interacted with us. We would appreciate the interaction, and any comments, please feel free to contact me. And it's a learning experience for both of us. So even me, I'm improving, inshallah, in my webinars. We're not used to having the sessions online, but we're learning together. So thank you for giving me this opportunity.
Thank you very much, and all of you have a good night, and see you inshallah on Wednesday. Thank you very much.
Thank you. Bye.